Hi, I'm Dr. James Reinerson, President of BlephEx. So we're going to record a definitive step-by-step BlephEx procedure video that really outlines the do's and don'ts of performing a proper BlephEx technique. Now the patients that we're looking for, of course, are our dry eye and Blepharitis patients. That's your elderly population who have more years of a thicker biofilm causing this chronic inflammation. But don't overlook your contact lens patients as well. We know that contact lenses allow for an earlier, thicker, more aggressive, more virulent biofilm that begins establishing from the moment they go in their contact lenses, which leads to blepharitis, dry eye, and contact lens intolerance in these patients. So don't overlook those. Another important group of patients we're looking at is your pre-cataract and pre-LASIK patients. These surgical patients benefit greatly from the BlephEx procedure in that we're opening up the meibomian glands, we have better oils, therefore better vision, and we reduce the risk of infection during surgery. Now, the very first step in doing a BlephEx procedure is very important. We're not putting numbing drops in right away. Our first step is to turn to the handpiece and the tips. And this is step number one. We want to put the foam, the lid hygienic scrubbing foam, or the BlephEx scrubbing foam into the back of the reservoir. You can see a little depression back here, and we're just going to pump that right in. 3 or 4 pumps of foam, and let that sit. Then we're going to open up our box of tips. Now, our new improved treatment protocols allow for 1 tip to be used per eye instead of the old 1 tip per lid. So you'll notice now that the tip packs only contain 2 tips, 1 for each eye to be used. So you open up that tip pack, you take those tips out, and you lay them in the foam on the back of your charging base, and you let those soak. And have the patient look up at the ceiling and just drop a numbing drop right in both lower lids, just like that. And then while those tips are soaking, and you want them to soak for about a minute, you take your consent form and you have your patient sign it. And the consent form is included. Second set of numbing drops, because many times, as you know, your patients will tear out the first drop because it slightly burns and stinks. Now you'll take one of your completely soaked tips for your first eye and note that it has a double-barreled design on the base. Little double-barreled design. Well, that matches that double-barreled design in the chuck. So it really only fits in one way. And you just simply take the chuck. I like to take it in my dominant hand, my right hand, and hold the handpiece in my left hand. I just think it's easier to load that way. Use your finger here to sort of manipulate this and get this lined up. And then it just shoves straight in. So it's a nice pressure fit. Now push hard so you really know it's seated down very, very well. Then I switch hands. I shield the patient and I hold the power button down for 2 seconds. So 1, 2, and now it's on. I shield the patient so I don't splatter the foam all over the patient. And we turn right to the patient and begin to go to work. Now, you'll have the patient look up towards the ceiling. I take my non-dominant hand, I pull down the lid margin, the lower lids where I typically like to start, and I bring my hand in nice and flush to the face. I'm not coming in like this with the tip up or floating in the air trying to freehand it. I brace my hand on the cheek, and it's sometimes helpful to bring that finger in, collapse the hand so you can get down nice and low, just like this. You stay parallel to the nose so the face of the sponge is on the lid margin. Now pop that lid margin down off of the globe, and then you just go to work. And it's a nice firm pressure. Now I can't emphasize enough how important it is to use a nice firm pressure in treating these eyelids. I'm treating rather aggressively, as you can see. You should see the lid margin pushing away from you with the force that you're using, and almost stop the motor like that. If you push too hard, it just stops. That's the force you want to use. So it's just starting to slow down that motor. Now, this is a very good patient that we're treating today. If I was coming in and I was a novice, and this is a very common mistake that early BlephEx users make, is they'll want to be gentle to the patient and they'll come in and they'll treat very lightly. And you see how instantly the patient begins reacting? Because a light treatment is much more uncomfortable. It's actually very ticklish. So you want to come in very firmly and push hard. It makes the treatment more comfortable and makes it much more effective. After 30 seconds or so, I'm going to reverse the spin. Now spinning the other direction, you can't tell in the video, but the little sponge is spinning in the opposite direction, and we do the same thing again. I'm treating the entire lid margin, lashes, and especially over those meibomian glands. That's what gets that lid margin totally, completely clean. If you get wet, we'll just simply take a tissue and come in and dry that lid, dry your fingers so you can maintain good traction to get that lid down. And that's pretty much it. Then we hit the button again, and now it turns it off. So you give your patient a little break, they can dab their eyes, and we'll turn to the next slide. Now you turn back to the charging base, and you re-soak that tip for just about 5 or 6 seconds is all you need. Hold this down for 2 seconds. Now it's started. And when I get ready to reverse it, I'm just going to hit that same button again. Now the upper lids, there's a bit of a trick to it. And once you learn that trick, you'll find that upper lids are actually easier than lower lids. Initially, you'll think, well, how in the world am I going to get that upper lid margin treated? It's way up under there. Here's the trick I want you to do. You have the patient look down, way down, bring in your thumb. Now bring in your thumb flush. That means just flat. You don't come in at an angle like this. You don't come in at an angle like this. You come in flat right here. Now you want to be just above the lid crease. Just above the lid crease. That's the top of the tarsal plate. We're just above that. Now my thumb is not going to lift. See, lifting doesn't expose anything. We don't want to lift. This is counterintuitive, but what we're going to do is we're going to roll down. So my thumb's going to roll 90 degrees down, and while I'm rolling down, I'm also going to push in. And you see how that pops the lid margin out. I'm going to demonstrate that again. So we're going to roll down towards the floor and push back into the superior orbital sulcus. The patient will feel a little bit of pressure during that time. Same hand position here. Flush to the face, parallel to the nose. It's just a fingertip movement. I'm not using my hand to move. I'm not using my arm. It's just fingertip moving. And we get right in there on the lid margin and scrub the entire lid margin once again. If you pop inside sometimes, doesn't hurt a thing. And these patients will have a little bit of laxity to their lids. So don't be surprised if you pop in on the palpebral conch sometimes. They've had years of chronic inflammation, so the lid can be very lax sometimes. And maintain that steady pressure in once you've rolled down. So it's a roll down and push in. And what you'll do is, a very common mistake is, you'll get great exposure like this. You'll start treating, and then your thumb will forget what it's doing over here. And next thing you know, all you're doing is treating lashes. So you got to do both things at once. 2 steps here, roll. Step 1, push in a step 2, and maintain that while you treat. Now we're going to push the button again, reverse the spin. You hear the motor slowing down, that's what you want. You want to just pushing hard enough so it starts to slow the motor down. Try to keep the face of the sponge. If you have to go and reposition. Now I'm going to ask the patient to be very uncooperative. Squeeze your eyes really tight like you're an uncooperative patient. See, even in patients who squeeze and have that big strong squeeze reflex, I still own that lid margin. It doesn't matter what they do, I can still treat it. So just to demonstrate one last time, I'm going to roll down and push in, and that pops the lid margin out so I can get the face of the sponge on the lid margin, treating my Boehmian gland openings and treating lash follicles. All right, now we just finished that right eye. We're going to set the handpiece here before we take the tip out. Then we're going to turn to the patient and we're going to rinse this eye out. So just have them tip back, tip towards me just a little bit, hold a tissue here so you don't flood their clothes, and just squirt right in the eye. Have them blink a few times, look up high, blink a few times, and now let the patient dab their eye.
Okay, here's a word of caution. When you remove the tip, make sure you support the stainless steel chuck that the tip is sticking into. Support that with the other hand. We've had practices that after doing hundreds of procedures, they remove that tip, just pull it out. The chuck would stick on the end of the tip and it goes in the trash can. And they have to get a new unit. So support the chuck.
And that tip now is full of everything we're trying to get rid of. Excess bacteria, virulence factors, those are the toxins that are causing the inflammation that are being produced in the biofilm, and the biofilm itself. And by doing that, reducing that bacterial load, we're actually turning the bacteria off. We're turning off their quorum sensing gene activation. That's one of the critical factors in inflammatory lid margin disease. The bacteria build up their numbers in the biofilm, and once they reach a critical mass, a critical number of bacteria, quorum sensing gene activation occurs. That means the bacterial population can sense when they hit a certain quorum or a certain density, a certain population number, and when they hit that number, genes turn on. And it's those genes that start producing the virulence factors that eventually lead to chronic inflammation of the lid margin. So that's why we have to throw those tips away, get the virulence factors off of there, and debulk the bacteria numbers down to turn off their quorum sensing.
Okay, go back to your charging base, get your second tip.
And we're going to do the opposite eye. Now I'm right-handed. Right-handers always stand on the patient's right. Left-handers stand on the patient's left. I don't want to come over here as a right-handed treater and try to treat the left eye. Here's what happens. You can't get perpendicular to the lid margin, and this is important. You always want to stay parallel to the nose, perpendicular to the lid margin, whichever eye you're doing. If I'm right-handed and I try to treat the left eye, I end up coming in like this, and we don't want to be spinning into or away from the eye. The lashes don't clean well that way. You want to be in the horizontal, spinning in the horizontal plane like this. So I'm going to stand over there and show you how we treat the opposite eye. Now the trick to doing the lower eyelid, you're not going to reach right straight across if we're going to treat that lower lid, because if I do that, the nose always puts the finger up in your way and you can't get the lid and do a nice treatment because of the nose. So you'll need to do this C technique. Make your arm a C, reach way around, use the side of your thumb to pull down. And now you can get in nicely. You see that? It's just a reach around, the side of your thumb, pull down and expose the lid margin. So I'm going to start it again, 2 seconds down. That starts it. Shield the patient. Come around, and it's the same technique. Scrubbing, scrubbing, scrubbing. In the interest of time, I'm going to shorten this procedure. You guys get the idea. We're going to reverse it. Now again, that's much shorter than we want to treat. We want to treat at least 30 seconds spinning one way, and then 30 seconds, 30 seconds spinning the other way. And then off. Same thing, let the patient dab their eyes, take a break.
Now turn back to your charging base, re-soak your tip for 5 to 6 seconds again.
Now the upper lid on the opposite eye of my handedness, so the upper lid on the left eye if I'm right-handed, there's no special tricks there. So right eye is done this way, left eye you just reach straight across. There's nothing to impede you. Make sure the patient tips their head back, looks down, come in again, flush with the thumb, rotate 90 degrees, and push in. The pushing in is the final critical step. You see, if I just rotate down, that's half the battle, but when I push in, watch that lid pop out. That's what you want right there. Okay, so again, we're going to hold this down 2 seconds. Patient looks down, come in just above the tarsal plate. It's about a 1/2 inch, 3/4 inches away from the lash line. Roll down and then push in. That pops the lid margin out. I'm going to come in flush again. And you want the face of the sponge on the lid margin, not the tip. That's why you want to keep the back down. If you bring the back up and try to treat like this or treat like this, you're free-handed like this, you're not stable, you're not comfortable. And like this, you're treating with just the tip. You get better cleaning, get the face of the sponge on the lid margin. You keep popping it out there. Make sure you get those meibomians nice and unroofed, nice and clean, so that diseased meibum mixed with biofilm, I like to call it meibofilm, it can start expressing itself. It can slowly start working its way out. Now we're going to reverse. Same thing, maintain my exposure. Sometimes you'll need to reposition, so if you got to go over here and pop it out, if you have to go over here and pop it out, exposure is key. And we push it again, and that eye's done. Now we're going to remove this tip. We're going to toss it in the trash. And we've just completed a BlephEx procedure on this patient. So now the left eye is complete. Have the patient tip back, hold your tissue. Again, we're going to just squirt a few drops right there on the eye. Try to catch the efflux, squirt right in, blink, blink, blink. And that's it. Now this patient is biofilm free. For maybe the first time in their lives, they have a lid margin that's free of biofilm. That means that lid margin is free of excess bacteria, and it's free of virulence factors, and it will very soon be free of inflammation. This is what's going to help our patients get back to having normal healthy eyelids, normal healthy lashes, and very importantly, normal healthy meibomian production as well as lacquerable production. So just to review, let's talk about some do's and don'ts. First of all, you're going to make sure you soak your tips long enough, and that's your very first step. You're doing the treatment, make sure you treat long enough. Many first-time users will get in and start using a BlephEx. They think they've been there for 30 seconds and they've only been there for 10 seconds because it's something brand new to them and everybody's a little bit nervous when they first start. So treat long enough. You can't treat too long. More treatment's better than less treatment, just like more soaking the tips is better than less soaking. The other trick is push hard, be aggressive. When you treat the eyelid, don't come in and just treat like this and try to be gentle and try to be easy on the patient. You're actually making things harder on the patient. You want to come in and be aggressive. It's a firm treatment. Counterintuitively, the more aggressively and the harder you treat, the more comfortable it is. And that's a hard concept for us to sort of overcome, especially when we're caregivers and we typically want to take good care of our patients and be gentle with our patients. So we have to make sure we treat aggressively. The other tip, when you pull out the tip from the chuck, make sure you support the chuck. Grab the tip, support the chuck here before you pull the tip out. That way you're not going to damage this connection between the chuck and the motor. So you hold it in your off hand, use your dominant hand, take the tip, and remove the tip while you support the chuck. And again, do not forget to rinse your patients at the end. Now most patients will report a near immediate improvement. And if you want to have a little fun, do one eye on the patient. Now both eyes have been numb. Do one eye only and then ask the patient to blink. And you're going to be amazed at how many times you hear the patient say, wow, it just blinks easier, it feels fresher, it feels cleaner. Many times you'll already see better out of that eye because you've unroofed the meibomian glands and you're already getting some lipid production from the meibomian glands. So get your patients treated aggressively, treat long enough, and you're going to have some very, very happy patients. So I thank you for your time today. Feel free to contact our company with any questions about BlephEx, and we look forward to getting you guys on board. Thank you very much.
Before having a BlephEx treatment done, my eyes were very irritated and dry, and almost to the point where I didn't think there was a solution that was out there for it. And then the BlephEx treatment was suggested, and after having that done, I can immediately feel the impacts of better vision, cleaner vision, more tears. As a former baseball player, my vision was very important to me, and I wish I would have had that then. Just to be able to blink clearly and have tears that without having to use eye drops.